Right now, there's a kind of a cloud of uncertainty hanging over many healthcare plays, given that the House of Representatives approved what could turn out to be a very draconian bill that's a lot more about repealing Obamacare than replacing it. Of course, we have no idea if the Senate can pass something similar, although if they do vote on their own healthcare bill, it will probably be a lot more generous than the House version. Even so, if you're in the healthcare business, this is a turbulent time. On the one hand, the Obamacare exchanges have some real problems. On the other hand, a law that cost 24 million people their health care coverage definitely going to hurt the industry's profitability. Which brings me to AMN Health Care Services, AMN for you home gamers, a staffing company that provides hospitals, clinics, and home health facilities with solutions for recruitment, workforce management, executive leadership staffing, and workforce analytics services. This company is what's known as a managed service provider, or MSP, a type of healthcare cost containment play where hospitals basically let AMN use its expertise to manage the business side of things so that they can focus on what they do best, treat patients. Now, after years of outperformance, AMN stock hit a major roadblock after Donald Trump won the election in November. GOP took both houses of Congress because everybody assumed that Obamacare would soon be repealed. The day after the election, stock lost more than 14% of its value. Since then, though, the stock has rallied 40%, in part because the company delivered a good quarter in February, but also because many investors now assume that this Congress can't get its act together to pass that in. However, last week, the company reported again, top and bottom line results strong. AMN's outlook for the next quarter was some people thought a little bit weaker than what Wall Street expected. Stock sold off on the news. But you know what? I think that this is really a classic opportunity, as it has for a long time. Why? Because the compound annual growth rate is so good. So what are we supposed to make of the story, given the healthcare debate? Let's go straight to the source and check in with Susan Salka, the president and CEO of AMN Health Care Services, get a better sense of how our company's doing and where it's headed. Ms. Salka, welcome back to Mad Money.
Hi,
Good to see you.
Thank
Good to see you,
so
Susan.
much. Always great to be
All right,
here.
well, Susan, your stock has been one of the most consistent winners, and I think that people who are playing it for politics don't understand. There are demand drivers that have nothing to do with Washington that are going in your favor.
You're exactly right, Jim. You know, while we certainly pay attention to what's happening in Washington, it doesn't drive our business. The economy has been a really important part of our growth over the last 4 or 5 years, but also the aging population with so many more people hitting that magic 65. There's a greater demand and utilization. And then amidst that, we have a shortage of clinicians. In fact, we are at the beginning of what's expected to be one of the worst shortages of nurses, physicians, allied professionals, and leaders within healthcare.
And you have a statistic in one of your presentations. You're an incredibly transparent company and the best corporate governance. 50% of healthcare jobs are open right now?
That's right. In fact, we're at an all-time high. If you look at the BLS JOLTS data, there are job openings well over 1 million across the state.
Well, how are you going to find them?
Well, you know, we are a recruitment machine, and we are investing millions of dollars every year to make sure that we are recruiting the best talent for our clients, both for permanent positions, but also for temporary positions. So we can really leverage our capabilities and assets to do things that our clients couldn't and quite honestly shouldn't do on their own. And we're putting workforce solutions to play to help them be more efficient in the way that they manage their teams.
So is it kind of a land and expand? I mean, you get you give them the help. And that includes doctors, not just nurses.
Absolutely.
And then they realize that you can do far more for them, so that because it tends to be things that they're not that good at.
Yeah, well, I don't know if I'd say that, but I think we can be better. So yes, that's exactly what
they could do it in a more it's more cost effective.
Right. So we help establish a strong rapport through maybe a managed services program, and by being closer to the client and gaining credibility, we can see opportunities to help them in different ways. So it often starts with a staffing relationship, but then it can expand into some of our technology solutions, such as Avantis, where we help clients do a better job of predicting what their staffing needs are going to be by using data and making sure that they are able to schedule their staff to have the right person in the right place at the right time and not be caught off guard with recruiting shortages.
Why are there shortages? I mean, I know that some of it must be retirement from practitioners who went in during when I was in school.
Well, certainly the aging of the clinical population is a huge issue. Over half of nurses are 50 or older. It's even more for physicians. So many of them are hitting retirement age. Now, they may not leave the workforce, but they'll certainly cut back on hours. And at the same time, we have bottlenecks in the education system. In fact, the aging of the faculty within nursing schools is one of the biggest issues that's preventing us from getting more nurses through the educational pipeline. And on the physician side, there aren't enough residency programs in order to be able to create that future workforce. You also have the millennial workforce issue where they may not want to work as many hours as their 50-year-old counterpart.
Well, now, I also want people to know that you work with some of the great institutions. I've not talked about this before. Johns Hopkins, what do you do for them?
Absolutely. So Johns Hopkins is one of our managed services program clients, and we help them make sure that they have the right nurses and allied professionals in the right place. We also do some physician work with them. And, it's really not just Johns Hopkins. It's, all kinds and sizes of healthcare organizations, academic, large public systems, and even the small rural community hospitals that have some of the worst shortages.
Well, I support the Hopkins Nursing School. It's a great school.
One of the best in the country.
And if they're using you, then I know you are the best, because I've spent some time with them, and they are unbelievable. One last question. If you had to hazard a guess, Senate different from House, I mean, you know so many healthcare professionals. Where does it come out, or can it come out?
I think it's too early to tell what exactly is going to come out of the Senate. But what I do feel confident is not likely going to change the increasing demand for nurses, physicians, and allied professionals, and the need to become more efficient in the way that you manage your workforce. And that's exactly what we're about.
That is exactly why. That's why it's been such a fantastic long-term story. That's Susan Salka, the president and CEO of AMN Health Care Services. Read about it. This is one of the most consistent, no matter time in, time out, stocks that I have been able to discover. Mad Money is back after the break. Thank you, Susan. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.